Good morning and welcome everybody to today's full committee hearing examining the implications of the Affordable Care Act on the Department of Veterans Affairs healthcare. As we all know, about 3 years ago, the Patient Protection and Affordable Care Act, or Obamacare as it is commonly known, was signed into law. Today's hearing will focus on just one aspect of the law that I believe has received distressingly little attention from the administration and the media to date: its potential implications for the VA healthcare system and the many veterans that it serves. Despite informing this committee last summer that the department was developing a proactive communication strategy to inform veteran stakeholders about the potential impacts of the ACA, VA's website devotes just 2 sentences to the law, stating that it, quote, will not affect the current role VA has in the lives of America's veterans, end quote. But, as we all know, stating that the so-called Affordable Care Act will not affect the department is not the same as saying that it won't affect veterans. Secretary Shinseki testified before this committee earlier this month that the Affordable Care Act has important implications for VA. VA's fiscal year 2014 budget submission includes a request of $88.4 million to implement the provisions of the ACA and meet the department's responsibilities as a provider of minimum essential coverage. Buried in Volume 2 of VA's subject budget submission, lacking context, justification, or supporting data, is a single statement alleging that VA assumes that it will experience a net enrollment increase as a result of the law. What that net increase may be and why VA believes it will occur and what actions the department has taken to prepare for it are unknown at this time. Unfortunately, these are far from the only things we don't know. Less than a year from full implementation, we also don't know how veterans may respond to the new care options available to them, and how enrollment and utilization of VA health care benefits may be affected in turn, how increasing demands for health care services will affect competition for health care providers, and in turn, VA's health care workforce and recruitment and retention efforts, particularly for hard-to-fill positions like psychiatrists. Whether VA's current information technology systems are capable of fulfilling the law's data requirements, which include identifying individuals who are enrolled in the VA healthcare system and reporting their coverage status to the Department of Treasury, or if or whether the critical role of the VA healthcare system will change in the post-ACA national healthcare landscape. Sadly, I could continue. The report on uninsured veterans issued last month by the Robert Wood Johnson Foundation and the Urban Institute states that it remains to be seen the extent to which uninsured veterans would seek coverage through Medicaid, the VA, or other options under ACA, and whether and how this will vary across state lines. Former VA Undersecretary for Health, Kenneth Kaiser, published an article last year in which he stated the overall net effect of the ACA on the health care for veterans is uncertain at this time, although it will likely have a number of intended positive and unintended negative effects. Where the health care of millions of veterans is concerned, unknowns of this magnitude, this late in the game, is unconscionable. According to VA, we have to implement it before, and now according to VA, we have to implement it before we can find out what effect it may have on our veterans. This House has voted more than 30 times to repeal and replace various elements of the ACA, and I've been proud to support that effort every time. And it's no secret that I and many of my colleagues have been critical of the law from the start and remain even more critical of and concerned by it today. Increasingly, we are not alone. Just last week, Senator Max Baucus One of the chief authors and primary advocates of the ACA called the implementation of the law a train wreck. The American public cannot afford a train wreck. And what's more, our veterans do not deserve one. Thank you all for being here today, and I mean that with great sincerity. I yield to our ranking member, Mr. Michaud, for any opening statement that he may have.
Thank you very much, Mr. Chairman, for holding this timely hearing today. I want to thank our panelists for coming as well. Look forward to hearing your testimony. While the Affordable Care Act does not change the VA healthcare system and is not targeted specifically at veterans, it includes provisions that could affect veterans and their families. In light of the fast approaching deadline contained within the ACA, it is important for this committee to gauge where the Department of Veterans Affairs is in implementing the ACA. According to the Urban Institute, there are approximately 13 million non-elderly veterans living in the United States. Of that population, 1.3 million, or 1 in 10, are uninsured. This means that there are 1.3 million veterans who will need to select some type of medical coverage within the next year. How many of these 1.3 million veterans are eligible for VA health care? I don't know if we know that yet. What is being done to encourage those eligible to come into the VA healthcare system? How can we help those not eligible to understand their options and find insurance elsewhere? I expect the department to have an aggressive communication plan in place to inform veterans about the Affordable Care Act and how it affects them, what, and if any, they can or need to do to maximize their VA benefits. It is imperative that conflicting messages do not get out there and confuse our veterans even more. VA at all levels should be prepared to assist veterans in navigating what is sure to be a confusing process. And I understand that veterans may choose to receive part of their care through VA and part through another system, such as an employer health insurance programs, exchanges, and or Medicaid. Dual eligibility is not new to veterans, but it has been my observation that VA struggles with the minimizing fragmentation of care for those veterans who use more than one system. Accurate accountability, coordination, and engagement with external partners is essential in keeping track of where veterans receive their care, the quality of that care, and how it integrates for the health and well-being of that veteran. There are many factors that will play a role in the choice that veterans will be asked to make in the upcoming months. I'm also interested in understanding what the factors are. Is it the proximity to a VA medical facility? Is it cost? Is it quality? It is believed that females within the household make the majority of the family's health-related decision. VA needs to look at it for the service women veterans and address this important veterans population as well. We know from studies that individuals' health is highly dependent upon the family's well-being. When you include family members of veterans, the number of uninsured rises to 2.3 million. The department's fiscal year 2014 budget request includes $85 million for the care of the estimated 66,000 new veterans VA has identified who may choose VA for the health care under the Affordable Care Act. The 2014 budget also includes $3.4 million in the information technology budget to build the functionality needed to meet the requirements in the Affordable Care Act, such as identifying individuals who are enrolled in the VA health care programs that have been deemed as meeting the minimum essential health care coverage. I look forward to this hearing and look forward to VA on the methodology used in arriving at these numbers and to understand how the trends and expenditures will be tracked to ensure that there are adequate resources for VA to respond to changes based on the ACA. I believe that a smooth implementation can be achieved by 2014 if VA engages effectively with other federal agencies that it should engage with. So with that, Mr. Chairman, I yield back.
Thank you very much. Thank you to the first and only panel that's going to be here today before this committee. With us from the Department of Veterans Affairs is the Honorable Dr. Robert Petzel, Undersecretary for Health, and he is accompanied by Patricia Vandenberg, Assistant Deputy Undersecretary for Health and Policy and Planning, and Lynn Harbin, Deputy Chief Business Officer for the Member Services for VA's Chief Business Office. And with us from the Department of Treasury is Lisa Zarlenga, Tax Legislative Counsel, and she is accompanied by Jason Levitas, Senior Advisor to the Assistant Secretary for Tax Policy. Again, we sincerely appreciate you being here today, and Dr. Petzel, you're now recognized to proceed with your testimony.
Good morning. Thank you, Chairman Miller, Ranking Member Michaud, and members of the committee. I appreciate this opportunity to discuss the Department of Veterans Affairs implementation of the Affordable Care Act. I have submitted my written testimony for the record.
Without objection, it'll be included.
Thank you. I also want to acknowledge in the audience the presence of the Veteran Service Organization representatives. They are of invaluable assistance to us in meeting the challenges of caring for America's veterans. The Affordable Care Act puts in place comprehensive reforms that improve access to affordable health care coverage for everyone. The law allows all Americans to make health insurance choices that work for them, while guaranteeing access to care for the most vulnerable people. It also provides new ways to reduce costs and improve the quality of health care. VA is committed to providing veterans and all other eligible beneficiaries timely access to high-quality health care services. Veterans currently enrolled in the VA healthcare system and current beneficiaries enrolled in VA's CHAMP VA or spina bifida program will experience no change in their VA-administered healthcare programs, services, or benefits. VA currently provides high-quality, comprehensive health care to nearly 9 million enrolled veterans and other beneficiaries, and we will continue to do so under this new law. Since the enactment of the Affordable Care Act, VA has been hard at work to understand the law's impact on veterans, other beneficiaries, and VA's healthcare system, and to prepare for implementation of the law. VA will continue to focus on providing personalized, proactive, veteran-centric healthcare. Our ongoing efforts for successful implementation include identifying and implementing the operational requirements that we need, putting in place information technology requirements, coordinating efforts directly with other federal agencies such as the Department of Treasury and the Department of Health and Human Services. VA has also focused on developing and providing proactive communications with veterans and beneficiaries. To oversee and ensure a comprehensive and coordinated approach to implementation, VA established a health reform integrated project team. The purpose of this team is to examine strategies and operational issues that affect veterans and VA as a result of the Affordable Care Act, steer the implementation of the law at VA, and provide a mechanism for information exchange. When key components of the Affordable Care Act are implemented on January 1st, 2014, they will provide some veterans with new options for health care through other programs. Some veterans may become eligible for Medicaid, while others may become eligible for a tax credit to purchase health care coverage through the health insurance marketplace. These changes give VA the opportunity to communicate with veterans and other stakeholders about their implications. Under the Affordable Care Act, the federal government, state governments, insurers, employers, and individuals are given shared responsibility to reform and improve the availability, quality, and affordability of health insurance coverage in the United States. Starting in 2014, the individual shared responsibility provision calls for each individual to have a minimum essential health care coverage, qualify for an exemption, or make a payment when filing his or her federal income tax return. Under the law, VA health coverage meets the definition of minimum essential coverage. This means that veterans enrolled with VA healthcare and beneficiaries enrolled in CHAMP VA and the spina bifida programs do not need to take any additional steps to meet the individual responsibility requirement outlined in the law. Additionally, under the Affordable Care Act, states have the option to expand their Medicare programs, but are not required to do so. VA continues to monitor state decisions to determine the impact on VA beneficiaries in each of these locations. VA anticipates a modest net increase in enrollment as a result of the Affordable Care Act. The net increase will result from eligible, non-enrolled veterans enrolling in VA healthcare. VA will ensure all veterans can quickly access accurate and understandable information on the Affordable Care Act provisions and their impact on veterans. Mr. Chairman, our work to effectively implement the provisions of the Health Care Act will continue. We remain focused on providing veterans and other eligible beneficiaries timely access to the high-quality health care that our veterans have earned and deserve. My colleagues and I are prepared to respond to any questions you may have.
Thank you, Doctor. Mr. Lenga, you may now proceed with your testimony.
Good morning, Chairman Miller, Ranking Member Michaud, and members of the committee. I am pleased to appear before you today to discuss the Treasury Department's implementation of the Affordable Care Act as it relates to health care provided to our nation's veterans, including coverage through Department of Veterans Affairs. I have also submitted my written testimony for the record. There is no higher priority than giving veterans the honor and benefits they have earned through their service and sacrifice to our nation. We appreciate this committee's commitment to veterans and look forward to working with you to ensure that their needs are met. The Treasury Department's work to implement the Affordable Care Act has been guided by this principle of serving our veterans. We have worked in close collaboration with the VA to help us understand the needs of veterans and the VA health programs. Our goal has been to ensure that the tax provisions of the Affordable Care Act protect the health care veterans have today, while also giving them access to additional options. The Affordable Care Act provides for the establishment of affordable insurance marketplaces, also known as exchanges, which will open on October 1st, 2013, to help individuals compare health plans and enroll in the one that is best for them. The Affordable Care Act created a refundable premium tax credit to help make coverage offered through a marketplace affordable. A taxpayer may qualify for advance payments of the premium tax credit, which are paid directly to health insurance issuers and reduce the taxpayer's monthly premiums for health insurance. The premium tax credit is generally not available to an individual who is eligible to enroll in other minimum essential coverage, which generally includes coverage through government-sponsored programs and employer-sponsored plans. In developing our regulations implementing the premium tax credit, we worked closely with the VA to ensure that the rules worked properly for our nation's veterans. As part of this process, we determined that the general policy that denies the premium tax credit to individuals who are eligible for government-sponsored coverage could create problems for certain veterans and their families, because eligibility for veterans coverage can't be firmly determined at the time the individual is seeking eligibility determination from the marketplace. So after consulting with our colleagues at VA and considering the issue, we concluded that a specific rule was needed to ensure that veterans were not inappropriately denied the premium tax credit. Accordingly, our proposed regulations contained a rule that treats an individual as eligible for VA coverage only if he or she is actually enrolled in that coverage. The general result of this rule is that a veteran who is eligible for VA coverage may choose between enrolling in VA coverage or enrolling in coverage through the marketplace, and if eligible, receiving the premium tax credit that reduces the premium for that coverage. Our final regulations retain this general rule, but in addition, in the final regulations, we amended the rule to apply to non-veteran individuals, such as dependents, who may receive VA medical benefits under certain programs. Thus, the special eligibility rule applies not just to veterans, but to individuals who are eligible for benefits under the Civilian Health and Medical Program of the Department of Veterans Affairs, or CHAMP VA, or the VA Spina Bifida Healthcare Program. Beginning in 2014, the Affordable Care Act generally directs non-exempt individuals to maintain minimum essential coverage for themselves and their dependents, or make an individual responsibility payment with their federal tax returns. Section 5000 Cap A of the Internal Revenue Code, which was added by the Affordable Care Act, defines minimum essential coverage to include coverage under specified government-sponsored programs, eligible employer-sponsored plans, and health plans offered in the marketplace. The statute requires the Secretary of Veterans Affairs, in coordination with the Secretary of Health and Human Services and the Secretary of the Treasury, to determine which VA healthcare programs should be considered minimum essential coverage. In implementing our proposed regs under Section 5000 Cap A, we worked closely with the VA to identify those VA healthcare programs that provide comprehensive medical benefits. Based upon the recommendations of our VA colleagues, our proposed regulations specify that comprehensive medical benefits package authorized for eligible veterans, the CHAMP VA program and the spinal bifida program are each treated as minimum essential coverage for purposes of the individual coverage requirement. Thus, under the proposed regulations, veterans and other VA beneficiaries who are enrolled in these VA healthcare programs will satisfy the individual coverage provision of the Affordable Care Act. We will continue to consult with our VA colleagues as we prepare to issue final regulations on this provision before the end of this year. Ensuring implementation of the Affordable Care Act in a manner that understands and is responsive to the needs of our nation's veterans is a top priority of the Department of the Treasury. I've outlined some of the issues we addressed in recent guidance regarding the Affordable Care Act provisions within Treasury's jurisdiction. As we move forward with implementation, we look forward to working with the VA as well as with this committee to ensure that the Affordable Care Act works as well as possible for the veterans and their families who have given so much to this country. My colleague, Mr. Levitas, and I would be happy to answer any questions that you have.
Thank you very much for your testimony, and with that, I will yield myself 5 minutes for questions, and if necessary, we'll do a second round of questions as well. The first thing I want to focus on is that veterans' disability compensation and pensions are generally exempt from federal taxation, and this goes to both of you. Under the ACA, for the modified adjusted gross income calculation, would this same principle apply? In other words, are veterans' disability compensation and/or pensions excluded for the purposes of calculating income for eligibility for the premium tax credits?
Mr. Chairman, the computation of the modified adjusted gross income begins with adjusted gross income that's reported on your tax return. So anything that's excluded from gross income for normal tax purposes would also be excluded from the modified adjusted gross income. So these veterans' disability benefits would be excluded.
So the question is, has the VA estimated how many veterans will qualify for the credit, and what plans is VA making to address the potential change in veteran utilization of the system?
VA has calculated how many people we think are going to be leaving us and how many people are going to be accrued to the system in terms of who would be eligible for the tax credit. That would depend upon whether they elected to do that or not. I would have to turn to Ms. Arlen or to Pat for any specifics, but I'm not aware that we have calculated who would be eligible for the tax credit. Pat?
Mr. Chairman, we have estimated the potential out-migration due to the availability of the tax credit. However, as you stated so clearly in your opening comments, this whole phenomenon is going to be a function of veteran choice. So veterans, as they look at their options, will weigh their current service that they receive from VA, the scope of the service that we provide to them, the model of care that we have, and then they'll look at what would they be purchasing if they ask for a tax credit and have to make that choice. There's no way for us to gauge in absolute terms what the ultimate determinant will be in that veteran's choice. So we have to make a certain set of assumptions. As Dr. Petzel indicated, we estimate that there could be up to 1 million veterans who could elect to avail themselves of the premium tax credit. Reciprocally, there are, as has already been referenced, 1 million plus veterans who are eligible to enroll with VA to get the coverage that would constitute minimal essential coverage. That's what gives rise to our net analysis that you alluded to earlier.
So you're saying 1 million out, 1 million in?
That is the extreme range of the analysis that we've conducted thus far using the American Community Survey results and several simulation tools that help us to understand what drives an individual's choice in selecting insurance products.
It's pretty coincidental that the numbers would kind of balance themselves out, especially when the number is that high. But I guess, the question that I would have is, so you have a veteran with a family who may have a child who has a disability or something like that. The premium tax credit, I think, would be a draw for that veteran to leave the system and go into the private market, given the fact that they have the ability to get the tax credit. Am I misinterpreting, or is that correct?
Let me start just briefly with that, and we can, both individuals on my right and left, have something to say. It depends on what kind of coverage they are able to get and what kind of copay, if you will, they have to provide. The plans range from covering 70% of the cost of health care to as much for the Platinum plan as 90%. One was going to have to weigh whether the tax credit more than makes up for the copay or the expense that the individual that's in the marketplace is going to have to bear.
Yes, Mr. Chairman, we consulted with our colleagues at VA, and we tried to coordinate a rule that would work the best for both agencies and the veterans. And as I stated in my testimony, one of our top priorities was to ensure that the tax provisions protect the current health care that veterans have today while giving them these additional options. That being said, my understanding is that the VA coverage is free without no premium. And even with the premium tax credit, individuals going to the exchange will have to pay for either equivalent coverage that's currently provided to veterans or even lesser coverage. And so I don't think that the premium tax credit itself will drive veterans to leave VA coverage and seek out coverage on the exchange, although there may be unique circumstances that drive a veteran to choose one plan over another.
First of all, and I apologize, my time's running out. The care that's provided isn't free. It was paid for a long time ago, and I know you didn't mean it the way you said it, but
Absolutely, sir.
And the issue is, though, the family members that VA does not care for, and if a veteran cannot get the premium support if they are enrolled in VA, then they have to disenroll from VA in order to pick up the premium support. Is that true?
Mr. Chairman, the family can still separately enroll in the exchange, even if the veteran himself is covered through VA coverage, if they otherwise qualify for the premium tax credit.
Okay, I have follow-up questions, but I would like to go ahead and recognize Mr. Michel.
Thank you very much. Thank you very much, Mr. Chairman. Dr. Petzel, by January 1st of 2014, the VA, excuse me, must be in compliance with the Affordable Care Act. Under your implementation efforts for the information technology, VA has identified a system that is needed to support the ACA. Do you have any contingency plans in place if the latter part of the year that you look at it and you realize you cannot meet the implementation time frame?
Congressman Michaud, we have a plan and $3.4 million in the budget to provide for the IT links, particularly to IRS, that are necessary to be in compliance. We actually have much of this in place already, and I am confident that we will be able to have all of the information exchange IT systems up and in place by the 1st of January. I would ask Lynn Harbin if she has anything to add to that.
Yes, thank you, Ranking Member Michaud. VA has worked with CMS in the federal marketplace, both to better understand the business requirements and the flow of information. We have built an interface with the CMS Hub so that when a veteran or beneficiary is applying for the tax credit, that query will come into the VA and we'll be able to respond. We've actually already begin the testing process. We believe we're on track to have that in place before October 1 of 2013.
Have you given any thoughts, because the states have to play a role if they go into the exchanges, what it's going to look like, what have you. What effect will it have for some states who do not want to participate working with Health and Human Services to make sure that they are on time to implement it come 2014? Do you see that as a problem? And if so, what are you doing to try to address it as it relates to our veterans populations?
We are in communication with the states. We don't anticipate an issue in terms of the reporting. What is, I think, the important issue for us is in those 21 states that have elected not to enhance their Medicaid programs, what is going to be the reaction to both the state and the veteran community in terms of seeking other sources of care. And when we talk about a net effect of 66,000 or so people coming to us, the majority of those people we think are going to be coming to us because of differences in their Medicaid programs in different states, so that we would expect to see perhaps more people coming from a state that did not enhance their Medicare program than from those states that did.
So we are, as far as we know, that we have veterans who are enrolled in VA healthcare but do not rely on VA for their primary healthcare coverage. If they chose to seek private healthcare insurance in the marketplace, can they still qualify? I'm talking about the individual veteran.
Yes, they can. They can still be seen by us if they have sought care in the private sector. They would not be, if they get care with us, they would not be eligible for the tax credit. Just like if they get care with Medicare or with Medicaid, they would not be eligible for the tax credit. But yes, they could seek care with us.
So, but if they don't, they can seek care, but as far as the tax credit, if they just use VA for not as their primary health care, so they will not be eligible then for the tax credit, if I understand that correctly.
That's correct. I would ask Ms. Sarlinger if she has anything to add to that.
The rule is if they enroll in VA coverage, then they would not be eligible for the premium tax credit, Congressman. They could still enroll in a plan through the exchange, but they could only get the premium tax credit if they're not actually enrolled in VA coverage.
Have you looked at, or was it ever brought up during the rulemaking process, that if they only enrolled in VA for minor care, but not as their primary health care, whether or not they would receive tax credit for that primary care health coverage? Have you discussed that in the rulemaking process?
I would, anything that enrollment is what decides it, not what kind of care or the volume of care but if they're enrolled with us, then they would not be eligible for the tax credit.
Right, and our rules treat as minimum essential coverage the comprehensive VA coverage as well as the CHAMP VA and the spina bifida programs. I'm not aware if there are smaller programs within VA, but those have not been designated to be minimum essential coverage, and it's the minimum essential coverage enrollment in that keeps you from getting the premium tax credit.
That's what I was trying to drive at just a second ago, and I think the ranking member was trying to ask the exact same question. The concern is veterans can dual enroll now and go back and forth, and if I understand correctly, VA can bill third parties for services rendered, non-service connected. and you use that money as supplemental dollars to the VA healthcare system. So will you not be losing those dollars if you don't have a dual enrollment by the veteran?
That's correct. If there were people that were no longer duly enrolled, then we would not be able to bill their other insurance companies if they were private sector. The majority of our dual enrollment comes from Medicare, but you're correct. We would not be able to bill if somebody decided just to enroll with us and not to have dual enrollment.
And have you done a calculation yet based on the lost income to VA?
Mr. Chairman, we've done an initial evaluation, and at this point, it is emerging what that impact will be. We don't estimate it to be a significant impact. We'd be happy to discuss that with you in further detail in terms of the underpinnings. I didn't bring that with me today.
Did you say it was a significant impact or not?
It does not appear to be a significant impact at this point. We do have that analysis available. We could easily review that with you at your...
We would be delighted to meet with the staff or whatever and review that analysis.
Thank you. I would like to ask that question to be answered for the record. Dr. Rowe.
Thank the chairman, and that's a pretty easy number to find. If you make less than $88,000 a year, which is about 90% of the U.S. population, that would be probably most veterans would fall into that category if they have ability to have private health insurance like I've had all my life. So that shouldn't be a hard one to figure out. You guys have got the data. Problem with the healthcare system in this country is it costs too much money. It's too expensive. Secondly, we have people who are out there work every day and can't afford it. And the Affordable Care Act was supposed to do that. And what happened was it's actually forced the cost way up. And it may end up cutting the number of people who actually end up on who end up having private health insurance. It very well could. And this bill, basically, this Affordable Care Act expanded greatly in some states. Some areas it chose to do it. Medicaid, which is a program that's not working too well right now. And I can tell you, I believe you're going to have a lot more people, Dr. Petzl, come. And the reason is because exactly what was pointed out by Treasury is that the subsidy, the tax credit, is not going to be as much as what's going to be paid by the VA, which is no copay. And people make economic decisions, and veterans out there who are struggling right now, I think you're going to see an onslaught of people that come to the VA. I think there are going to be a lot more veterans use it because the other side, instead of making it more affordable, is making it less affordable for people. And so I think you're going to see more people. I have a question for Treasury. If the tax credit, the credit that you'll get to buy insurance on the exchange, if a veteran chooses to go to the VA for his or her family, those family members can get that tax credit. Is that correct? When we consider the VA minimum essential coverage, is that not? Am I right on that?
So what you're saying, Congressman, is that
here's a veteran over here going to the VA getting their health care, and he's got a family members, and they're going to get a subsidy because they can't get the care at the VA. They get a subsidy and buy it on the exchange. Am I correct on that?
That's correct, yes.
Well, am I also correct that in the private sector, if an employer provides minimal essential coverage, that by the rules that I've read, they don't have to provide, the government doesn't provide subsidies for those family members, at least for the spouse, to buy insurance on the exchange. Why that disparity?
Congressman, it's the nature of the way that the code is written for employer-sponsored coverage. Affordability is determined based on the self-only coverage.
But you see my point here. Those are two exact same things. And yet if I'm out here in my private practice and I choose to cover my employees, I'm not required to do exactly what you required someone who goes to the VA to do. Why is that?
There's just a difference in the way the code treats government-sponsored coverage and employer-sponsored coverage. And it's a rule that is unique to employer-sponsored coverage.
Who made the rule?
Pardon me?
Who created that rule?
It's in the statute, sir.
The rule is in the statute. We didn't write the rule when we passed the Affordable Care Act. It wasn't in there. I read the bill. That was not in there. The rulemaking occurred afterwards.
Congressman,
Right. Go ahead.
maybe I can try to explain.
It would be, I tell you, we do need an explanation because there are people out there that are going to lose their coverage. The other thing I think is very important, and I want to hear what you've got to say, is that we better doggone well explain to the veterans who use, for instance, myself, I've chosen not to use, I have good health insurance. I don't want to step in front of a veteran, and many of us are like this out there. I talk to veterans every day who have private health insurance, and we know there are a lot of guys and veterans struggling, and we don't want to take up their slot. Well, we better doggone well explain to them that if they get some coverage, as Mr. Michaud said a little bit, that they can lose, that you can't, they lose that benefit, that exchange benefit, if that happens. In other words, they no longer can qualify for those. So they're now stuck essentially in the VA system. We need to, that's the first time I've heard of it was today. Now, your answer.
Actually, I would just like to, Congressman, I'd like to clarify a point that you just made. It's if the veteran has minimum essential coverage, then, or his family has minimum essential coverage, then they cannot get the premium tax credit. And so that minimum essential coverage has been defined to include the comprehensive VA coverage, or the CHAMP VA or the spinal bifida program. I'm not aware if there, I mean, perhaps Dr. Petzel could explain if there are other small, you were saying small benefits, and my understanding is that the minimum essential coverage that VA provides is a comprehensive coverage.
Back to why the other, if you could indulge me for 30 seconds.
Sure. Congressman, so the general way that the tax credit is set up is that an individual who is eligible for other coverage, be it government-sponsored coverage or employer-sponsored coverage, can't get the tax credit. So the idea is if you have other coverage, you're supposed to get that, not the tax credit. So in developing our regulations on the tax credit, we realized that that rule could create some issues for veterans because it may not always be possible to determine clearly whether when they go to the exchange or the marketplace and try to get an advance payment of the tax credit, whether they are eligible for VA coverage or not. So what we did is we created a rule that effectively gives veterans a choice, whereas an individual who is eligible for employer-sponsored coverage, generally they have to take that. An individual who's eligible for veterans coverage can choose between taking the veterans health coverage or they can also choose to get the tax credit. So and our understanding in working with our colleagues from VA was that this would help veterans to be able to take advantage of either option and get the most help they could.
Okay, I yield back.
Am I the only member of the committee that's confused? I'm just, what's just transpired, I am lost. Because you came back and you just made a clarification, and I want, again, if a veteran is eligible to be in the VA system, is his family eligible to get a tax credit?
Yes.
Okay.
Yeah, and our rule is actually based on whether the veteran is enrolled in the VA system.
There's a difference now, being
Right.
enrolled and not enrolled.
That's right. If he's not if the veteran is not enrolled, then the veteran is also eligible to get the premium tax credit.
Okay. There's the point. There's a reverse incentive for the service-connected veteran to stay in the system. And what I'm trying to figure out also is the calculation of household income. If a veteran stays in the system, how do you calculate the household income for the family members and whether or not they receive the tax credit?
Mr. Chairman, the income for the tax credit computation is based on household income, and so regardless.
But if they're separated, and you've got the veteran in the VA system taking health care there, but the family's over here, and they may not have any income. I mean,
That's right. It's, I mean, a function of the statute looks to household income, The IRS really only has the ability to enforce household income because that's what's reported on the tax returns. We don't, the IRS doesn't have the ability to look to individual members of the household income unless they impose additional reporting requirements. And so by function of looking at the household income, the veteran's income would be included. That being said, if the veteran has income that is excluded from gross income, such as disability payments, that is not counted towards household income.
Ms. Brownlee.
Thank you, Mr. Chair. Dr. Petzel, I wanted to follow up with you because I, share your concern about Medicaid and the states, some expanding Medicaid and others not. And I'm wondering if you have done or have been able to do any kind of a prediction or assessment in terms of understanding that all states haven't made any final decisions. But in terms of where the concentration of veterans might be relative to these states and those who are uninsured, and what that impact is, and do you know what the impact would be?
Thank you, Congressman Brownlee. We have as I said, 27 states have elected to expand Medicare, and 21 states have decided not to, and there are 3 states that have not yet made a decision. 3 of the states that have elected not to expand Medicare are very populous and have large. Beg your pardon?
Medicaid.
I'm sorry, Medicaid. My apologies. 3 of the states are populous states, and they have a large concentration of veterans. And we expect that, again, depending upon exactly what the Medicaid program will look like, that we would be seeing more people migrating towards the VA healthcare from those places than we would be in places that have expanded their Medicaid coverage. And we have, Pat, you might be able to add a little bit to that.
Yes, we're focusing on Florida and Texas in particular at this point. What we've done is taken our estimate of the uninsured and spread that over the states as best we can ascertain from the American Community Survey results that we've used, the census survey. And then we've looked at that in relationship to the states who are and are not going to expand Medicaid. We've also established a network of contacts within our VISNs who are establishing more explicit communication with state government regarding their intent, the scope of the services, the way they're going to deploy those services to Medicaid beneficiaries. And we're attempting to ascertain at this point what the attractiveness would be in those states where we're going to see Medicaid expansion, and reciprocally in states that aren't going to expand, what the healthcare needs of those individuals might be, so that we further hone our communication to those uninsured veterans. So we are trying to take both a macro approach at the highest level and then take it down to the micro level of the states and really drill down to get a closer linkage to state governments for this discussion.
An important aspect of this, Congresswoman, is what are the plans going to look like, and both in terms of Medicaid and in terms of what's on the insurance exchanges, so in the insurance marketplace. How are they comparing to VA healthcare, and will it be economical for someone to forego their VA healthcare and get the tax credit, if you will, and participate in that program or enroll in Medicare? And there has been no crispness yet on the part of both the insurance industry and the Medicaid programs in defining exactly what their coverage is going to be. We're keeping as close track of it as we possibly can, but that's going to be an important determinant.
Thank you. And just another follow-up question, Dr. Petzel, and you mentioned your assurance that a plan will be in place versus for outreach and communications, and the IT system will be up. I think you said be ready to implement in January of 2014. I just want to make sure that you're going to be ready I think we need to be ready before that in terms of being sure to outreach when the implementation of the Affordable Care Act takes place.
Oh, I apologize. I meant the IT program. I did not know that the question was referring to outreach. Our outreach program is nearing completion. We have developed a very comprehensive outreach program, including multiple types of media. Our intention is that that will roll out in May and June, concomitant with the Health and Human Services rollout of their information about the Affordable Care Act, so that these two things will mesh together very, very well.
Could we submit that plan into the record that you've developed, or is that possible?
Absolutely, yes, we can.
Great, thank you.
Mr. Kaufman?
Thank you, Mr. Chairman. So if I understand it correctly, what will the result will be, I suspect, a significant expansion potentially in enrollees in VA healthcare, because it doesn't have to be service connected. It can be simply the means tested aspect of it. Is that correct?
We expect that there will be, Congressman, some increase in enrollment. We expect that there'll be some people who will leave us. And the net effect of this is what we've been talking about. And we're anticipating that in the early stages, as this is rolled out in 2014, that this would be about 66,000 people.
So it's for those states that took the Medicaid option, I would assume that you wouldn't see a lot of movement in those states.
Congressman, we think that it will be less.
Okay.
We think that it will be less, but again, a big determining factor is going to be the nature of that Medicaid program, and how does it measure up against what's available in terms of VA healthcare?
Okay, but don't we
expect less?
Okay, don't we know that at this time though?
No.
Oh, we don't. Okay. My other question would be, in terms of the families. So it's not an issue from your perspective. So if you have a former member of the armed services, and I think it's 180 days consecutive service to the country, and they meet the eligibility criteria, let's say the means tested aspect of the eligibility criteria, and they qualify for the VA, then what you're saying, and maybe this is a Treasury question, is that the family still then, because of the household income is unchanged, would be eligible for whatever subsidies exist in the exchange.
I would say yes, but...
Yes, that's right. As long as the family's household income is between 100% and 400% of the federal poverty line, then they could qualify for the premium tax credit on the exchange.
And then, but how do you subtract out the service member from that equation? In other words, I understand the eligibility in terms of household income, but then let's say you have a two-parent family with 3 children. And so it's one of the adults is a service member that becomes VA eligible. Then they make that election.
Okay.
Okay, and so then how do you determine, you're not requiring that, to your knowledge then, is it required that the subsidy, that the premium be applied to all members of the family, or is the service member subtracted out?
The premium, and Jason, I'll let Jason talk a little bit more to the detail, but the premium is computed based on a percentage of household income, which would include the veteran, but it's based on the premium paid for a benchmark plan that would only include the individuals who are covered by that plan.
Okay.
And so that's at a high level how the computation works, and I can let Jason talk a little bit more about that.
Sure. So the way that the tax credit tries to take into account the size of the family and the sort of resources it has to pay for health care is the amount of the amount of the tax credit is set so that the amount the family has to pay is a percentage of its income, and that percentage is based on the federal poverty line. And the federal poverty line varies based on family size. So if you had a family of 4 or a family of 5 who had the same income, then the family of 5 would have to pay less because their income would be at a lower level relative to the federal poverty line. So they would be thought to have less resources that they could spend towards their premium.
But I think the fundamental issue, the question really before us is that if a family of 5 walks in and one of the service members, again, is eligible for VA care and makes that election. So the family's purchasing health insurance through the exchange. Is there some level of discrimination whereby the family's forced to pay for part of the service member in buying that policy through the insurance exchange, who is covered by the VA?
Congressman, that's a very good question. The way that it works is that the amount the family has to pay is the same generally whether they enroll, say, all 5 members of the family in the plan or just the 4 members and the veteran takes the VA coverage.
So that's a problem, Mr. Chairman. That is a problem. I yield back.
What happens if both parents have service-connected disabilities and are able to use the system, but they have 3 children? How then do you calculate the premium subsidy for the 3 children?
So it would be based on, so the actual computation is the difference between a percentage of your household income and the cost of a benchmark plan that's covering the individuals that you're actually going to cover on the exchange. And so you would go to the exchange and you would get a plan for the 3 children, and you would look at what that benchmark premium costs. And then it's the difference between a percentage of your household income. That percentage varies depending upon how close to the 100% or 400% of the poverty line the family is. And so it's based on a percentage of the household income, the difference between that and the premium for the benchmark plan.
Dr. Petzl, don't you see this as a disincentive for the veteran to use the VA system? Because a service-connected veteran does not have to enroll in the VA system in order to receive their health care. Is that correct?
That's correct.
Why would they enroll?
There would be no reason for them to enroll. They don't, and again, they could still get their health care with us, but they don't have to be enrolled. And we're still working through what's going to be done in terms of the tax credit in that kind of a circumstance.
And so do you see it as, again, if you will, a perverse disincentive to the veteran not enrolling into the system? And what impact is that going to have on you being able to develop your budget over the coming years?
Well, Mr. Chairman, when you look at what's going to be available to that service-connected veteran on the outside and what's available to that individual within the VA for a 100% service-connected or service-connected individual comes close to a platinum plan, maybe even exceeds that. There's virtually no expense associated with that health care coverage for that individual. They're not going to find that in the outside world. They're just not going to find it.
Ms. Negrete McLeod. Dr. Winstrup.
Thank you, Mr. Chairman. Is a VA benefit given a value that's subsequently added to the net household income? Someone is receiving that benefit as though is it?
I'll take the first crack at that, Dr. Winstrup. And no, they are not.
Okay.
You may want to comment further, but the health care benefit is not considered part of the family income, assets, or whatever.
Right. So a disability benefit, is that what you're?
No,
so the
health care benefit.
Oh, a health care benefit. Yeah, it does not. It's not included in their gross income for purposes of determining the household income.
Okay. So is a family in any way penalized for the veteran and the family taking their VA benefits or enrolling in the VA? Are they penalized as far as tax credits or anything? Or I'm just still kind of confused on the whole calculation process.
Basically, like I said, so the computation is that the credit is equal to the difference between what the family would have to pay for their benchmark plan, and that's the plan that's actually going to cover whoever's in the exchange. So if the veteran gets coverage through the VA and the rest of the family goes to the exchange, you would find a plan that covers the spouse and 2 children, or just the children, whoever's not getting the VA coverage. And you would look at that premium cost for that plan. And then what the statute does is it looks at a percentage of the household income, and it says, basically, we think that families should be able to pay that percentage of their income in premiums for health care. And so it takes the difference between what the statute thinks that families should be able to pay of their household income and the difference in the amount that you're paying on the exchange, and the credit is the difference between that, and that credit is paid to the families to help them. It's paid to it could be paid directly to the insurer, or it could be claimed by the families later on their tax returns, but it helps them pay for the premiums on the exchange.
Thank you. I yield back.
Ms. Kirkpatrick?
Thank you, Mr. Chairman. Secretary Petzel, I have a concern about the delivery of the medical services to these new enrollees. So my first question is, does the VA have capacity in its existing facilities to take 66,000 new enrollees?
The short answer, Congressman Kilpatrick, is yes.
So you will not need to expand any of your existing facilities?
We would not need to expand any of our existing facilities. We will be monitoring the healthcare providers that we have available, and if we need to add healthcare providers, we would do that. That's part of what the $85 million might be used for. But at the present time, we believe that we can absorb the 66,000 new people with the $85 million that's in our 14 budget.
And do you have a breakdown between rural and urban veterans? How many of those new enrollees are living in rural communities versus urban settings?
I don't have it with me, but we do and can provide that.
If you could provide that to me. Then my other question is about the actual providers. I represent a very large rural district in Arizona. We've opened up some new VA clinics, but we have a very difficult time getting doctors to staff those clinics. Lots of them have PAs, nurse practitioners. So do you have a plan? Have you discussed about how you're going to bring in more physicians into the VA system, more PAs, more nurse practitioners, so that we can have more coverage at those levels? My concern is that it takes so long to get through medical school, and we don't have enough physicians nationally as it is, and how is the VA going to deal with that?
Well, Congressman Kilpatrick, we don't have any trouble attracting PAs and physicians into the VA system. The issues that we have are attracting them into rural areas. This is not just unique to the VA. This is a problem across the country, as I'm sure you know from looking at the healthcare community outside of the VA in those rural areas. And the ways that we're trying to cope with this are, number one, using PAs and other substitutes for physicians when we can, and two, telehealth. We have now got a number of primary care telehealth clinics around the country, mostly concentrated in Colorado, which of course is highly rural, like Arizona and New Mexico, and they have been very successful. That's where there is a nurse clinician at the site, and the individual and the nurse clinician are connected to the primary care doctor at a remote area, such as back at the medical center. And you'd be surprised at how much of the primary care interaction and care can be delivered in that kind of a format, where you have somebody that can do the physical exam things that are needed, where you have somebody that can monitor the blood pressure, et cetera. And I think that that is going to be an important part of our future ability to deal with the highly rural areas.
Well, let me just express my concern again that I'm afraid that veterans are going to be turned away from these rural clinics and sent to emergency rooms in the hospital because there's not a physician there, a primary care physician there, or overwhelming these clinics. And is that something that you're working on and addressing?
It is, and we are providing incentives for people to move into rural areas. We can provide debt forgiveness from medical school. We have a lot of flexibility in terms of our salaries, and we are pulling out all those stops to try and recruit into those highly rural areas.
And is it possible to recruit some of the returning veterans from Iraq and Afghanistan who've been medics and have that kind of training? Is there an effort to do that, to get them to the rural areas?
There is an effort. I can't say that's specifically focused at rural areas, but there is an effort to recruit out of the military, the clinical professionals that are leaving the military, absolutely.
Well, let me just request that you do focus somewhat on the rural areas, because those veterans are really lacking in the delivery of services.
I hear you.
So thank you, Secretary. I yield back.
Ms. Walorski.
Thank you, Mr. Chairman. Dr. Petzel, I had a kind of a different question, but I just returned from Afghanistan yesterday, and I want to tell you that my respect and admiration for our brave men and women and what our military does is second to none. And I am just so grateful to our nation, to our veterans, and yet I was perplexed by the questions that our servicemen from my district asked me. They're young men and women, and they're already concerned about their VA benefits. And I thought how sad it is that they're carrying out these, protecting our freedoms, and at the same time they're concerned because of things they hear about the benefits that they will or won't receive. And the question I have is that, as we all know, January 1st of this year, the President's medical device tax went into operation, and I've already heard from medical device manufacturers in my district expressing concern how this new tax will raise the cost of life-saving medical devices. Do you anticipate the medical device tax having any impact on the VA?
I beg your pardon. No, I don't expect it to have a significant impact on us.
And I find it interesting because the medical device tax is a huge issue in my district, and we had access to a recent report issued by the VA that stated, quote, the VA anticipates a 2.3% increase in costs to offset the negatively impacted profit margin for the vendors and manufacturers that will be paying the tax. This is based on commentary and published opinions that vendors will pass this additional tax on to all consumers, including the VA. So what would have changed your opinion from the one in this report?
I'll have to go back and take this for the record, if you don't mind, and find out what the analysis has shown here. I'm just not familiar with what it has shown.
I would appreciate it because in my district, one of the things that we're finding from hospitals all the way down, this is a comprehensive progressive tax. Every single unit that touches these devices adds to the tax. And what I've seen from our brave servicemen and women that I just came from in Afghanistan is they deserve the best of everything we can possibly give them, including these life-saving medical devices. And if that report is true, that that would be a significant hit. My question would be, if you could follow up and get back to us, is what is the cost to the VA going to be?
I will get back to you.
I appreciate it. Thank you. I yield back.
Thank you, Dr. Petzel. I think your testimony earlier said that you expected 66,000 net individuals or new individuals coming into the system and an $85 million budget increase in 2014. Is that correct?
That's correct.
The budget submission itself shows a net enrollment increase from 2013 to 2014 of 68,415. So am I to assume that the vast majority of people coming into the system are ACA veterans?
I'm not recalling, Mr. Chairman, the net enrollment figure we expect enrollment to go up by about 1.3% in 14 in total. And I would have to do the quick math to see what kind of a number that yields.
Well, and the reason I'm asking is because you're asking for an additional 85 million to handle a number that it appears that you've already calculated for, and so if I'll get a question to you for the record that's specific to that, because I'm looking back to the advanced appropriation 2013 to 2014, expecting an increase of 48,000. I'm just trying to see if we can figure out where that additional money is going. Are we double counting? You know, what's happening? Mr. Michaud, recognize you now if you want to go.
Thank you, Mr. Chairman. Yeah, I want to just try to further understand, whether or not the ACA would be a disincentive for veterans, or an incentive for veterans to leave the VA healthcare system. And I know if I understand it correctly, if a veteran is enrolled in the VA, that qualifies, and he will not be able to get the tax credit if he has a private plan. My concern is if you have a veteran that is enrolled in the VA just for prescription drugs, and that veteran lives in a rural area, and he's got family problems with his children, and they prefer to have their health care taken care of locally. In order for them to get the tax credit, he would have to disenroll or unenroll from the VA in order to fully benefit from the tax credit.
Congressman, to just make sure I understand your question, the veteran is enrolled in the comprehensive VA coverage, but all they use it for is prescription drug coverage.
They seek their primary care elsewhere for whatever reason, because they would prefer, rather than travel long distance in a rural area, to get their health care closer to home. And then it gets into a whole other issue when you look at what if that a single parent veteran is enrolled in the VA. Then you get into the whole issue about, can they get on their, stay on until the 26th in their private health care plan. And so there's a whole other slew of questions that concerns me that might encourage a veteran to disenroll from the VA.
One of the things that we were trying to accomplish with the rule that requires enrollment as opposed to just being eligible was to sort of give veterans, access to, give them flexibility, access to options, and also give them the ability to take advantage of the, of the great health care that VA provides for them today.
That's true. If I might follow up on that, that might be true if a veteran lives near a VA healthcare facility, but if you have a veteran that lives a distance away, and it's a lot easier for that veteran to receive access closer to home if there is, military sexual trauma involved, and they'd rather go to their health care provider closer to home because VA does not provide those types of services. So that's a choice where that veteran will have to decide whether or not they're going to give up their primary care to disenroll from the VA, because all they need the VA for might be for prescription drugs. And then you get into the other situation: what do you do with a single parent that has health insurance that's got VA coverage, but also has health coverage for their children as well? Well, and they would not be eligible for, as I understand it, for the tax credit, correct, for a single parent?
Children would be subject to, if they're not enrolled in the VA coverage, then they would be eligible for the tax credit.
But what happens if you have a single mom who's enrolled in the VA system?
She could still get coverage for her child on the exchange, even as long as the child is not enrolled in.
But does she qualify for the tax credit?
With respect to her child, she does. She could. If she otherwise satisfies the income requirements and everything, she could get the tax credit with respect to her child that's enrolled in the exchange coverage.
Oh, okay, so she doesn't have to, she still can receive coverage from the VA.
Yes. So, I mean, what we try to do is give veterans sort of the maximum flexibility. If they're not near a VA hospital, then they can still get the premium tax credit and enroll in a plan that may, have providers that are closer to them.
Right. So if a veteran is covered by the VA and they do not live near a VA facility, they still can keep their health care coverage and get the tax credit.
Well, in order to get the tax credit, they would need to enroll in coverage on the exchange and not enroll in the VA coverage for them to get the credit. But they could still have their families get the credit if they wanted to actually enroll in the VA coverage.
But what about that veteran, for whatever reason, is using his primary health care because he's getting the excellent care he needs because he lives a long distance away from the VA, say in this particular case for military sexual trauma. They're already getting health care through their private insurance, and that individual will have to make a decision if they want to keep the tax credit, whether to unenroll from the VA. You're forcing a choice.
Yeah.
I don't know if Dr. Petzel...
That's correct, Congressman Michaud. If the veteran were enrolled in VA healthcare, whatever it might be, whether it's just getting medications or getting primary care, if they're enrolled, then they are not eligible, as an individual, they are not eligible to participate in the tax credit. They can still have other insurance. They might be engaged in Medicaid, they might be engaged in Medicare, they might have private insurance, and they could still come to us, but they would not be able to get a tax credit. And so the individual is going to have to weigh the value of the tax credit against the services that they're getting.
Thank you.
I think it's important for the record also that it's this committee's understanding, you were talking about the rural veterans, 40% of the veterans in this country live in what are termed rural areas. So I think you have brought to bear a very important point, Mr. Michaud. Dr. Benishek?
Thank you, Mr. Chairman. Well, I'm really worried about some of these assumptions that you guys made down there, that there's going to be a net increase of 66,000 people. I don't see that as being anywhere near correct. I mean, I don't see anybody disenrolling from VA. Why would anybody want to disenroll from the VA? I mean, certainly not to get on Medicaid. You're not going to take Medicaid versus the VA. I'll tell you that right now. I don't know where you got the idea that some people would prefer to be on Medicaid than get their benefits in the VA, but that's not reality.
First of all, you wouldn't have to disenroll.
Well, you're saying this 6,000 is a net from the people that are not going to take it anymore versus those that are going to get it. So I don't see why anybody's going to disenroll. Explain to me that.
I think it might have to do, Congressman, with proximity care, the accessibility of care. It might have to do with the specific circumstance. And absolutely. We're not going to know these things with absolute certainty until we get to the point of actually implementing the law.
What I'm saying, and this is the whole point of this, is I think that this estimate of 66,000 is far short of the mark, and if you're planning for 66,000, you're not going to be able to provide the care for what I think would be 1 million people. I mean, how many veterans are out there now that are not enrolled in the VA?
I think the better number to look at, Congressman, is how many people are without.
No, I asked the question, how many veterans are out there now that are eligible that are not enrolled?
Probably about 8 million.
What if all those people decide because they're not going to have access to health care, they want to join the VA health care system? I mean, that's really the maximum number you're looking at, right? You didn't even consider that. That's 8 million.
No, Congressman, those people, the vast majority of them already have health insurance.
What if they lose their health insurance?
That's a different circumstance, but they do now.
There's a lot of people losing their health care insurance under the Affordable Care Act. So is there any contingency about those people? I mean, I've talked to lots of employers that are telling me that they're not going to be able to provide health care for their employees anymore because of the cost. I mean, I have an employer that tells me they can't even get a bid on his insurance for his 800 employees because the uncertainty there. So what if he decides just to, I'm going to pay the $1,000 fine and I'm going to throw everybody in the exchange? And that's a reality. So you haven't made any contingency about that? There's 8 million people we're talking about.
Congressman Benishek, our calculations are based on the uninsured, the veterans that we've identified as being.
But that was 1 million.
And that's about, no, it's 1.3 million. Of those 1.3 million, about 1 million of them are actually eligible for VA health care. And so our calculations, and
So that's a long way from 66,000.
that's because we don't believe that all of those people are going to seek care with the VA.
Where are they going to get it? Medicaid?
They're going to get it from Medicaid. They're going to get
People
it
are not
from
going to choose
insurance
Medicaid over the
exchanges.
VA, Dr. Petzel. I'll tell you that right now. I mean, I've been taking care of patients for 30 years, and believe me, if they have a choice between the VA and Medicaid, they're going to go with the VA every time. So that is like a really, ridiculous assumption. And if you're thinking that you're going to get by with only 66,000 increase, you're vastly mistaken. You're going to be a lot more people, and then I don't see any plans from what you guys are telling me to being able to accept 1 million more people. This is really concerning. This whole assumption of 66,000 increase is, to me, a real disaster in the making. So I guess I'm out of time. Or am I? Do I have a little more time? I guess I do. I mean, I just think these assumptions you made, Dr. Petzel, are really incorrect, and I guess I don't know how you came across those assumptions. Do you have any idea?
Well, I absolutely do, and I would disagree with you, Congressman, that the assumptions are ridiculous. We very carefully have looked at this, and we have particularly looked at the behavior of the individuals that might be eligible to move back and forth, and we think that the prediction of about 66,000 people is a good prediction.
Well, I can tell you as a physician for 30 years, if I have a patient, he would much rather be in the VA than be in Medicaid. And if they're eligible for the VA, they join the VA, period. No doubt about it, no matter how far they got to travel, because getting care through Medicaid is much more problematic than getting it through the VA, as difficult as the VA can be. But I will tell you that, that is an assumption that is absolutely wrong, in my experience. Time.
Dr. Petzel, what happens if the scenario that Dr. Benishek refers to occurs, and all of a sudden you do have a flood of individuals that come into the system? I mean, how do you handle that when you're already overburdened?
Mr. Chairman, we will assess this on a very close and regular basis. Again, we have to plan for what we think is the most likely possibility. You would not want us coming here and saying there are going to be 1 million new patients and we need X amount of money to do this. This is our best estimate based on a tremendous amount of work as to what the influx will be, and we will monitor this very closely. If it proves not to be the case, then we will have to look at.
Can you handle a twofold increase in your estimation?
Could we handle 136,000 new patients?
Yeah.
I'd have to go back and.
That's not a wild assumption. 1 million may be, but a doubling of the number may.
I would want to go back and look at and do some calculations before I answered that definitively.
Mr. O'Rourke?
Thank you, Mr. Chair. If the number is close to 60, 120,000, or 1 million, how will these new enrollees impact the other programs within the VA system, job placement services, educational assistance, housing assistance? How are those going to be impacted, and also how will you communicate the availability of those programs to the new enrollees?
Well, we would want to, Congressman O'Rourke, first of all, we would want to make them aware of those programs just like we would with every other new enrollee in the system. I can't speak specifically about the impact on those Veterans Benefits Administration programs and the effect that these new people coming in might have, because I would need to talk with them about what the uptake is of people that come into the medical care system primarily and then are referred to VBA. Be delighted to take that for the record.
Yeah, that would be a good one for us to work with your office on and just make sure that we understand the impact system-wide for all these enrollees, whatever the number is, and to ensure that there's a plan to effectively communicate these other programs to them. So appreciate that. Mr. Chairman, I yield back.
Mr. Bilirakis.
Thank you, Mr. Chairman. I appreciate it. Again, on the 66,000, the prediction, Dr. Pretzel. Well, describe the benefits of enrolling in the VA as opposed to an exchange, because a lot of these veterans are already eligible. Give me an explanation as to why they would want to enroll in the VA as opposed to taking an exchange.
Thank you, Congressman Bilirakis. It's going to depend upon the individual veteran circumstance. So let's take an example. Let's take an example of somebody who is a Priority 8 veteran, is eligible to enroll in the VA. That individual is going to have co-pays and other things within the VA system. And that would, the amount of that would have to be weighed against what the plan that he was enrolled or she was enrolled in at the exchange offered. It would be, it's a veteran by veteran decision. And you would then have to also take into account accessibility, availability of services, etc. It's very hard to predict any given individual. I can tell you, I think without question, that the service-connected individual who basically would have no co-pays and no expense for VA health care would, very unlikely to be enrolling in a program in the exchange, because there's just so much more value associated with that VA health care. But other individuals, it would be a veteran by veteran decision.
Okay, well, how did you come to this conclusion? I think it'll be more than 66,000 as well. But how did you come to that conclusion, that net increase? How did you base that? How did you base it on? In other words, the quality of health care in the VA? Give me elaborate a little bit on that.
Congressman, I will. Obviously, we couldn't interview and talk to each one of those million veterans that we think might be coming to us or not coming to us. Excuse me. We looked at the National Survey of Veterans, which gives us information about what veterans do and what their choices might be. The Survey of Enrolled Veterans, which gives us good information about the experience of the people that are already with us, and you can match what they do and their choices against their income and a number of other demographics. And we looked at the American Community Survey, which is the census survey that has questions on it that relate to veterans. The best information sources about what choices people might make that we have available to us. I would ask just briefly if Ms. Vandenberg has anything to add to that, because her office is the group that did that.
Just building on what Dr. Pretzel just outlined, we've also engaged with our consulting actuary, Milliman, who is assisting us in understanding veteran behavior relative to the public at large. They're doing a lot of work for other clients who are assessing the implications of the Affordable Care Act. And so we've drawn on some of their insights regarding what causes the consumer to make choices regarding coverage, cost, etc. So those are the resources that we've employed.
Thank you. I have one question, one last question. Dr. Pretzel, in your testimony, you outlined 3 areas to help enhance the veteran's experience with the VA, including, I know you touched on this a little bit, including providing each enrolled veteran with a personalized health benefits handbook, expanding call center hours of operation, and streamlining the VA enrollment application form and process. We are now less than a year away from full implementation of the ACA. Where in the process is the VA for each of the 3 enhancements mentioned in your testimony? When will they have access to it?
Thank you, Congressman Bilirakis. The benefits handbook is done and out. The streamlining the enrollment, I think, is in process and probably is close to being done. I think the most important part about this, though, is the information outreach effort, which we plan on rolling out in May and June in concert with Health and Human Services rollout about their information about ACA, the Accountable Care Act in general. And maybe if we could just take 30 seconds, Lynn, and go through the educational and outreach documents that are about to be going out.
Certainly. With our enrolled veterans, in addition to that tailored Veterans Handbook that we just spoke about, we're rolling out
The
some...
the veteran will have access to the handbook.
The handbook has already been...
It's already done, but when will the veteran have access?
That's correct. We're wrapping that up. We've sent out almost 8 million handbooks.
Okay.
We will continue mailing out new books to new enrollees as they come on board. In addition to that, we'll be mailing out that one-time letter to all of our existing enrollees, reminding them of their health care benefits with VA, as well as any information about the tax credits and things that they may need to do. We are also embarking on making changes to our websites. That includes va.gov, My Healthy Vet, and the eBenefits portals. We have social media that is being developed, Twitter, Facebook, as well as our customer support, our call center. We have trained agents that are ready to address veteran and beneficiary inquiries. And we have printed materials that are being developed. Those include things like posters and brochures and fact sheets. Those will be ready for dissemination at our points of service. That includes both our VBA regional offices as well as the VA medical centers and our CBOCs. And the material will be available to be downloaded from the web.
Very good.
What about the non-enrollees? You talked about the veterans that you're sending out a one-time letter to all those that are enrolled. What about those that aren't enrolled?
Thank you, Chairman. That's an excellent question. We are also preparing to communicate with them regarding VA's health benefit plan. We have information about the care that we offer, as well as guiding them through the enrollment process. We're doing some website changes, including a new online tool that will help veterans make decisions about VA healthcare and inform them, as well as guide them through that enrollment application. We're doing some social media as well, public service announcements, and again, our call center is available and will be posted so that veterans have a single place to go to get answers to their questions.
Thank you, Mr. Chairman. I yield back.
You've got a big task in front of you, and I get that. But I'm very, very concerned about the ability to provide the information to the veteran. Are you in this booklet talking about the fact that you can no longer be dual enrolled? I mean, obviously you can be if you want to pay, the extra premium, but there have been a lot of veterans out there that have enjoyed dual enrollment. And I envision a veteran being in the system and going over here and having health care over here, or disenrolling from VA, and VA either appropriately or inappropriately notifying IRS, and all of a sudden the veteran gets hammered because the veteran just doesn't know, and they get penalized because they have been accustomed to this system for so long, and all of a sudden we're changing the system.
If, Mr. Chairman, I could just comment on that. First of all, the benefits book does not have anything in it about ACA. That's a book that just describes the benefits that they're eligible for. The campaign,
This is a huge change in the system, and you don't have anything in there about the ACA and you've based your whole model on behavior of the veteran population. This is going to change it drastically. And that's why Dr. Benishek was asking the question, how can you have confidence in the models that you're using when they've all been based on past participation that's going to be upended on the 31st of this year?
The benefits book is intended, Mr. Chairman, to, and it started being rolled out more than a year ago, to make people very cognizant of what they're eligible for in VA. The material that's going to be rolled out in May and June to all of our enrollees is going to very explicitly explain to them what their choices are and what's available, and then provide them access to interactive websites and to call centers where they can get their specific questions answered. We think we're going to be able to provide our enrollees with a lot of very specific information and help them evaluate the choices they're going to make. The veterans that aren't engaged with us will have to be reached through public service announcements that lead them to our websites, lead them to the other material that we have.
Dr. Petzel, I guarantee you every member sitting at this dais and all 435 House members know how to reach the veterans in their community better than a public service announcement.
And
we can put a letter in their mailbox. We can call them on the telephone, 30,000 veterans a night if we need to in order to do that. I mean, we need to come up into the 21st century and stop using, the public service announcements. I'm very fearful that not you, but the entire healthcare system is changing. And you are telling the veterans what their benefits are, but you're not really telling them what how the relationship is changing because of the Affordable Care Act.
That's what the material that we're going to be rolling out, Mr. Chairman, is intended to do. And I want to take you up on your offer. One of the things that we need is your help in educating and your constituents about what's happening, about what's going on, and we will provide in any form that you would like or you need whatever kind of materials that you would like to have, because we depend on you. Veterans talk to you, they talk to all the representatives, you talk to their service organization people to spread the word in those kinds of forums about what's available and what's happening. I think I very much appreciate
the word
that
that I'm going to spread is going to be much different than the word that you're going to spread, because I'm going to tell them about the difference that they're about to run into at the end of the year. And, I believe that you do provide quality health care and some of the best in the world within the VA system, but I see a disincentive for the veteran coming up at the end of the year, particularly the rural veteran, and what they're going to have to go through. I can see the IRS coming in, penalizing the veteran for making a very simple mistake because they've been accustomed to doing something for a number of years. VA's obviously not interested in helping them cross that bridge that was created by the government, but we'll be more than willing to help in any way that we can to help the veteran population get through this huge change within the system. Mr. Amadei, do you have any questions?
Thank you, Mr. Chairman. I just want to, I think I understand what you're saying about those folks that are enrolled. What's the general number of people who aren't enrolled in your system at this point in time?
There are probably 8 million veterans that aren't enrolled that would be eligible. I mean, you have to ask the question, are they eligible? That would be eligible for us. We focused on the uninsured as being the people that are going to be confronted with choices about what they do, because they're going to have minimum essential coverage, and they're going to look to turn someplace to get that minimal essential coverage. And so the question that I think affects us the most is, what are those people going to do? How many of them are going to seek VA care as their minimal essential coverage?
Doctor, when you refer to those people, are you talking about the uninsured in that group?
I'm talking about the 1 million uninsured that are eligible for VA care, correct.
How would you describe your demographic knowledge of those folks who are insured through somebody else or are eligible for VA membership in the context of the coming ACA? And I'll tell you why I asked the question. because I think that's a 7 million potential pool who's, and I understand what you said about case by case, and is there an exchange, is there not? But that's something when healthcare turns healthcare matriculates into the ACA time that has potential huge impacts on who your clients are going to be. And so I'm asking the question because if your assumption is that those 7 million are going to kind of stay in other programs, I hope you're really good at that, because it's the only group that I've heard of that's like, oh, we don't care how that's going, we'll stick with what we're going. I think people are going to be shopping big time, and if you're one of the options, that influx issue concerns me.
We have, Congressman, the biggest piece of information that we have about that group of people is a survey that's done by the Census Bureau and our survey of enrolled veterans, and trying to extrapolate what those enrolled veterans say to that non-enrolled population. And Pat, you can maybe add some details, but this is our best rendering of all of that data in terms of what people will do. I'll let you continue.
And before you do, let me just say this, and this is no disrespect to you, but the what's going to happen is a daily changing thing based on regulations from multiple sources, ahead of schedule, behind a schedule, money for this, money for that. So I'm not attempting to blame the VA, but I don't know how you're going to predict what's going to happen to that group when, quite frankly, many people within a few blocks of where we're sitting now, with all due respect, on both sides of the fence, aren't sure what's going to happen.
Thank you for the opportunity to respond to your observation. I would just say on a personal note, I've characterized these changes, and Chairman Miller, I would agree with what you said earlier, as probably the most profound wave of change that we're going to see in American healthcare since the advent of Medicare and Medicaid. And I'm old enough to remember I was in nursing school when those pieces of legislation were enacted, so I've been a student of this evolving phenomenon, and this is a sea change beyond anything that we've seen. That said, when we do our survey of enrollees annually, we observe that in their self-reporting, 77% of our currently enrolled veterans have at least one other form of health care coverage. And so we've gleaned certain insight from that insofar as to meet the requirement for minimal essential coverage, an individual only has to have one form of coverage. So to your question about those currently non-enrolled, potentially eligible individuals, we believe that a certain portion of that population already has other forms of coverage. Yes, they're eligible, but if they already have another form of coverage, we also look at segmenting our overall enrolled population between those who are under 65 and those who are over 65, and more than half of our population is over 65. They are enrolled, for the most part, in Medicare, and so that will suffice as their minimal essential coverage as well. I couldn't agree more that this is extraordinarily complex, that our tools to assess the impact are not perfect, but we've tried to take, as Dr. Petzl has said several times now, the insight from the American Community Survey, our prior veteran surveys that encompasses individuals who are not currently enrolled, our survey of enrollees, and work through that with our actuary to estimate. And this is our estimate.
Did you ask, real quick, did you ask on your surveys how many veterans would leave the system and take the additional dollars, the tax credit? I mean, was that a question that was asked over the last year?
We've added a question to the survey of enrollees going forward.
You did not have it over the last year.
No, sir, we did not.
Why do you think that was?
because at the time that we were fielding that survey and getting our clearance to deploy that survey, the particulars of the impact of the Affordable Care Act in relationship to veterans enrollment vis-a-vis what we've discussed this morning with the Department of Treasury were not completely confirmed. And so it would have been a speculative question.
When did they get confirmed? This morning?
No, sir, we've been working with the Department of Treasury for a year now.
But I'm talking specifically about, because Dr. Petzel says it's very difficult to be able to ascertain from the veteran population who would stay in the VA and who would go out into the exchange or take the tax credit. No, it wouldn't. Just ask the question of those that are enrolled. What would you do?
Mr. Chairman, the problem is that they would have to understand all of the options. You're not going to be able to do that on the survey. The best information is going to be garnered after the rollout of the information about ACA in May and June, and after we have rolled out our information.
Do you know who you sound like?
No.
Speaker Pelosi made a comment very similar to what you're saying. She said, we got to pass it before we know what's in it. Now you're telling me that you got to roll it out before people know what's in it. Who's going to help them? Are you going to help them understand it? Because what you've said so far is you're just going to tell them about all the good things that VA does, but you're not going to help the veteran make. Who's going to help them make that decision?
Oh, no, that's not what I said, Mr. Chairman. We are going to explain to them what their options are under ACA. We are going to lead them through, hopefully, a decision process. We're not just going to tell them what's available. There will be information available about what the Affordable Care Act is offering.
But you did a benefits book.
The benefits book is a different phenomena. The benefits book, sir, was to describe to them, going back a year and a half, actually started 2 years ago, what their benefits were. So there was a clear delineation.
Yeah, I'm sorry. I thought it was something that was done in response to the ACA. I apologize, and that was a misunderstanding on my part. Mr. Michaud?
Thank you. And I can understand the dilemma you're in as far as trying to get the information to the veterans, and so they can make their decisions. And I know what you're saying, Dr. Petzel, as far as, you won't be able to do it later on because there's some states that don't know what their exchange is going to look like, and it is problematic because the system's not in place. So it's going to be more difficult, particularly for those states that are falling behind. But my question actually does deal with information and making sure the veterans have as much information as possible to make the right decision. So here's an example. You have a veteran that lives in a state that in the far corner of a state that's surrounded by, or 3 other states border that state. So that veteran goes into the VA to want to know what's benefit for them. Can they enroll in the VA, or would the enrolling in ACA be better? Since they live in a corner where you have 4 states that might have a different plan, how are you going to help that veteran understand which might be better for them? Because that would mean the VA employee would have to be very familiar with four different plans, depending on where that veteran goes. I'm not sure in those particular cases whether, if it's on a border state, whether VA veteran would have to go to one state or the other state for their health care, and which means that the employee would have to realize 4 different states.
Congressman, I just wanted to clarify that as far as the exchange goes, I believe that an individual is eligible to purchase a plan on the exchange in their rating area or in their state. So I don't think they can shop around.
No, my question, a veteran goes to VA, says, I'm not enrolled in the VA, I'm thinking about rolling in the VA, what's the best option? And that veteran might have, depending on where they live in that particular state, their VA facility might be in any one of those 4 states. I'm not sure the example. So how are you going to be able to give that veteran the best information that you can, because that VA employee, in order to give that advice, they'd have to know what the 4 states plan is, plus the VA program.
In those circumstances, we would have to have the information available, as you point out, Congressman Michaud. And one of the best ways to do that probably is to have this organized around the networks, where we know that then would cover the various states. But you're right, there are places in New England, particularly, where there would be a variety of different options, and we need to make sure that there's information available about all of them.
Yeah, because it will make a big difference to that veteran, because they're going to be confused enough, and for the VA employee having to know VA, plus if they're going to advise them what might be the best plan, they'll have 4 states or more, not depending where they're located, that they potentially would have to do. My second question is, what is Health and Human Services doing to educate someone that's talking to them? For instance, you could have a veteran that doesn't plan on going to the VA system, don't know what their benefits are, but they actually might go to the state to look at the exchanges. Is Health and Human Services providing the information about VA health care as well, and how are they providing that information to the veteran that might just go to them instead of the VA?
We'll let Ms. Vandenberg.
Are amenable to including certain information on their website. They will not include the VA on the marketplace, because technically we are not an insurance product that can be listed in the insurance marketplace for the general public to evaluate. So we've had a good working relationship with HHS. We're also in close coordination with them regarding their communication rollout. They've begun a series of regional meetings, and we have active engagement with them in the HHS regions with our network VISN points of contact, participating in those conversations out in the field, so that we can assure synchronization of their message going out with our message to veterans.
Could they, or do they plan on having, I'm not sure if they're doing questionnaire type question when people apply for ACA, but could they have a couple of questions on there? Number one, have you served in the armed forces? And number two, if so, are you receiving health care benefits today from the VA?
We continue to be in dialogue with them about the inclusion of that type of a question, so that we have a flag that we can pick up early in the process.
And where are they on their decision? Because that seemed to be, if you're cooperating with HHS, I mean, those are 2 questions I think would be very important to find out whether or not a veteran might be eligible for VA health care but doesn't know it.
I think that decision is pending at HHS.
Okay. And hopefully it's common sense. But I guess my last question, actually, the IRS, and to follow up on the chairman's concern, since this is new, and as we move forward with implementation, that probably might be a little rough start getting going, and you could have a veteran that does make a mistake, or a VA makes a mistake, that could trigger a penalty that the veteran would have to pay. So how lenient will the IRS be as far as where someone might be penalized because of the letter of the law, but because of a mistake that caused them to do that? Well, what's the, how hard are you coming down on people who might unintentionally are in non-compliance?
Congressman, I think the penalty that you're talking about is the penalty for not having the individual responsibility payment for not having minimum essential coverage. And so I think you're probably referring to the veterans who have no coverage. They currently are not enrolled in or have VA coverage, or do not have any other coverage. And but my understanding of the way that the 5,000 Cap A proposed regulations work is we have defined as minimum essential coverage the comprehensive VA benefits, the CHAMP VA program, and the spina bifida program. If the if the veteran is in any one of those programs, they have minimum essential coverage and they will not be subject to a penalty. And I don't, is that limited to enrolled? It is limited to enrolled. Okay. If they do not have that coverage and they do not enroll in another plan, then they would be subject to the individual responsibility payment. The statute sort of phases in that payment, so it starts off very low for the first year. I think the statute understood that people will probably make mistakes, the first couple years, and so the penalties are intended to reflect that. So they're low for the first couple of years, and they phase up.
But what if they're not identified correctly and they're penalized? Is there a mechanism to prevent that from happening? My first question. My second question, what if a veteran actually is in the VA, says, I'm covered, no problem, but his spouse might not be?
Right.
Because yeah. So what about that situation?
Congressman, there will be a form that people fill out with their tax returns to say whether they and their dependents are covered by a health insurance plan. And so if a spouse is not covered, that would be reported, self-reported on the form. And then the penalty would be computed based on how many people in your coverage family do not actually have coverage.
What if they don't file an income tax form?
There's an exception to the individual responsibility payment. If you have income below the filing threshold so that you do not have to file an income tax return, you're not liable for the penalty at all. And you don't have to file a return to tell the IRS that you're not liable for the penalty.
So you still didn't answer the question. So someone did make a mistake or whatever, and in filing the tax form is an honest mistake, how lenient is the IRS going to be? Are you going to come down with a hammer on every case, or are you going to say, well, it's just getting implemented now and we're going to be flexible, and yes, people have made mistakes, rightly or wrongly, but we're not going to be penalizing them right from the get-go?
I think that by making mistakes, it means that you didn't enroll in coverage at all. I think that generally there are a number of, well, first you would look to whether you have any exceptions. There are a number of exceptions in the individual responsibility payment, one of which is whether the coverage would be affordable based on your household income. There are other exceptions for, hardship, for religious convictions, for things like that. So you'd first go through the litany of exceptions to see if you were in fact subject to the penalty. But if you report that you don't have coverage and that you weren't eligible for any of the exceptions, then for the first year the penalty amount is very low. And my understanding, I don't know exactly how the IRS would administer it. I'm happy to look into that to see how they would administer it if someone reports a penalty for the first year.
Dr. Rowe?
I thank the chairman. I've been a veteran for 38 years and a physician for 42 and a half years. And this is the most uncertain time in my career right now about how healthcare is going. And I talk to my colleagues, and I know Dr. Petzl mentioned that he was having problems in rural areas of finding physicians, and there's no question that that's true. And you're having to push care to lower and lower level providers. And I'm just, we've sat here for 2.5 hours talking about this, and these are knowledgeable people that I'm around, smart, knowledgeable people, and I don't think we fully understand what you're talking about. How in the world is a booklet going to explain that to somebody out where I live? And I did a town hall Monday night. I could have spent the whole town hall, and everybody else would have walked out scratching their head, because I don't think anybody understands it. Private business doesn't understand it. And to Mr. Michaud and the chairman both, I think there are incentives to get out of the VA system and to get into the VA system. There are incentives that are pushing you both ways, and depending on where you live, as Mr. Michaud pointed out. If you live in an urban area, your incentives may be one thing and maybe another. And by the way, I want to ask a question. I had a little chuckle. Who thought up the individual responsibility payment? It's a tax. Who dreamed that little acronym up?
I think it's actually in the title of the provision, 5,000.
I love all of these little things like that. It's just, let's call it what it is, and it's a tax if you don't buy it. My question is, how in the world, and two questions, how long is the form you got to fill out to decide whether you have a coverage or not? I mean, is it just one little check box, or is it a multiple thing? Is it 2 pages, 10 pages? To add it to your already overly complicated tax form, and it's not your fault. Congress wrote all that stuff. I'm not fussing at you guys. You're just doing what we directed you to do. But is it that? And then how in the world are you going to monitor? I think there are 130 million people working. I don't know how many you probably know that better, that have jobs. At least 130 million tax returns sent in each year. And how do you monitor that? How do you have the capacity to know anything this complicated that every person, and then what happens is that Mr. Michaud said, if you just decide not to check the box, how long is it going to take you to chase me down? If I just decide I'm not going to tell you, or I check yes and I don't have insurance.
Well, Congressman, I haven't actually seen the form, but my understanding is the IRS has been working very diligently on all the information reporting forms and the forms that the individuals will fill out, and they are keenly aware of trying to keep it simple and short. I don't think they're trying to add a number of questions at all. I mean, my understanding is that they are looking at sort of something as simple as a checkbox. My understanding of the way that the IRS will actually implement.
Want to bet a steak dinner on that?
Like I said, I haven't seen the form yet, but the way that the IRS will actually administer all of this is there's sort of a series of information reporting. The IRS will be receiving information returns from the exchanges, from private health insurers, and from employers to report what coverage they are providing for individuals, and the IRS will have the ability to sort of cross-check these information returns in order to determine who is covered and who is entitled to the premium tax credit.
Well, is Medicaid considered, or you may not know this, and Dr. Petzl, you may not either, but is Medicaid considered an essential benefits package? And by the way, have any of y'all read what's in an essential benefits package? I have, and it looks pretty comprehensive to me. It looked like as good as, does Medicaid cover that? Is that an essential benefits package if you get Medicaid? And that varies from state to state, remember. And what happens when a state doesn't expand Medicaid? Is the current Medicaid plan an essential benefits package? Because I can tell you what ours was 15 years ago in Tennessee, which we voted, the governor elected not to form a state exchange, and number two, not to expand Medicaid. And the Medicaid has been pared down and down and down because of what it provides, because of cost.
Dr. Rowe, Medicaid is considered to be minimum essential coverage. The plans still may vary, and the eligibility is the thing that I think people are talking about when they talk about expansion. Expanding those people eligible for Medicaid.
Let me stop you there, because if you look at what we provide now in Tennessee, what we provided before was 20 years ago was a Platinum Plus plan. But right now, if a private business could provide what Medicaid, their costs would be a lot lower. And what's happened is there are two standards there. And there's no question there is. I'm just hearing what you said, because Medicaid doesn't provide anything near what I provide in my own practice. And yet, I think we probably just barely make the essential benefits package.
Congressman, my understanding of what the minimum essential coverage has to cover is they have to cover, they have to cover the categories of essential health benefits, but they don't need to cover every single benefit that is listed as an essential health benefit in order to qualify as minimum essential coverage.
Again, Mr. Chairman, ranking member, thank you for having this hearing today, which didn't clear the smoke out of the room maybe, but helped a little bit. And I think we need to continue to do this because I definitely, Dr. Petzel, want to see the booklet go out and explain this to our veterans next month, because we spent 2 hours and haven't explained it to me yet. So with that, I yield back.
Thank you very much. Mr. Michaud said he has no more questions. The questions that I have, we can submit to you for the record. I do want to go back, Dr. Petzel, to your testimony and your opening statement where you do talk about your proactive efforts that VA has taken, including assessing the potential impacts and opportunities presented by the Affordable Care Act. Then you come on down to about the 6th or 7th bullet. It talks about assessing VA's enrollment business processes and identifying opportunities for enhancing veteran experience, including providing each enrolled veteran with a personalized health benefits handbook in order to make the veteran aware of their health care benefits. So to me, I draw the conclusion that this is in relation, this new handbook is in relationship to the ACA. No need to make a comment. I'm just saying that's where it came from. One other question that I had, you mentioned category 8 a few minutes ago. You haven't lifted the category 8 number that's out there now. I mean, those that are not enrolled cannot get into the system, correct?
That's correct. We have not changed that.
Do you intend to change it?
No, there is no plan to change it.
Okay. And also for the record, in some pre-hearing materials, VA stated that the department used a contractor to assess the potential impacts of the ACA on the VA healthcare system. Is that correct?
Yes, we did have some brief services from a contractor.
Would you provide the committee a copy of that report?
We will.
In a timely fashion.
Absolutely.
Thank you very much. And with that, I want to say thank you very much to you for being here for over 2 hours now. We're very appreciative of that. All members will have 5 legislative days to revise and extend their remarks, add any extraneous materials without objection. So approved. And with that, this hearing is adjourned.